The biggest battle we will ever have to face is the battle between you and you. It's the battle of taking your mind to that limit and then breaking through. On the Mindful Experiment podcast, we will share concepts, universal laws, and interviewing individuals who have done just that, who have gone through the dark times and through those moments allowed their light to shine bright. I'm your host, Dr. Vic Manzo, and I want to thank you for listening to the podcast and taking this journey with me as we discover different avenues to break through those limits, expand your reality, and evolve into the person you desire to be. So sit back, relax, and enjoy the show. Hey everyone, this is Dr. Vic, and you're listening to The Mindful Experiment. As we dive in this week, having an opportunity to discuss, interview, and talk about Dr. Diva's journey, his medical journey, of how it transformed him to a more holistic perspective and so much more. It was a really great interview, a really great chat with him and getting into the mindset and how he went through and what he knew and the limits of what he knew when it came to nutrition and things along that nature, when it came to his health issues that he had, and how he had to truly transform and do his own research to gain deeper understanding of a whole different world that he wasn't exposed to before, but due to his own health crisis, he was doing just that. Just a little background on Dr. Diva. He is a board-certified osteopathic physician and has extensive knowledge and training in integrative and functional medicine. Dr. Nagula grew up in Alexandria, Virginia. His interest in medicine developed at an early age when he decided to follow in his father's footsteps. Dr. Nagula graduated from Lake Erie College of Osteopathic Medicine. He completed his residency in physical medicine and rehabilitation at EVMS and a fellowship in interventional pain medicine at Emory University. He opened a practice in rural South Georgia, as well as the first AAHC certified ambulatory surgical center in Georgia, where he performed cutting-edge interventional procedures. Recently, Dr. Nagula completed training in integrative medicine under the renowned Dr. Andrew Weil. He recently relocated to the great Washington, D.C. area to be closer to his family and friends. He is committed to his passion for healthy lifestyles. He believes most diseases that plague this country can be prevented and sometimes treated by positive health and lifestyle changes. As a chiropractor, I couldn't agree more with that last statement. That majority of the things that we face as a society, we can work with holistic measures to do just that. So, without further ado, here is Dr. Diva. Dr. Diva, welcome to the show.
Thank you so much for having me.
I'm excited to have you on. You have a very fascinating story of your battle with cancer and all those other things that you went through, and you have a book to talk about, your journey and so much more, which I know we're going to get into, and I have a lot of questions for you there. Normally, when I first begin, I always like to ask, how did you get into what you're doing now? What's your story?
Yeah, so I'll get into this a little briefly, but it all was a culmination after a lot of things that occurred in my life. And at the time, I was practicing medicine, and I was practicing in the field of interventional pain management. I started this practice up from the ground up and without any knowledge of business, and just kind of grew into it and learned as I went along. And after 7.5 years, I had 2 thriving practices in 2 different states, a surgery center, and 25 to 30 employees. And I was just the only man that was running the show, seeing patients and running the business. And I exited it in 2000, at the end of 2012. And that was, for me, it was just a time where I was so burnt out. Patient care was for me, I wasn't in the moment with the patients because I had so much stress in my mind, and I figured I just needed to get out and just reduce the amount of stress that was going on. And I exited my practice in 2012. And so 2013, I was really about just living life, turning a new page in the chapter of my life. I just gotten married, was planning on having a family. And at the end of the year, I was going to a doctor's office appointment, And I've just a regular routine visits to check on my blood work and things of that nature. And I had this complaint of these um, enlarged like areas in my neck, and I assumed there were cysts. It didn't even dawn on me the possibilities that it could be. I just thought it was superficial, and I was really wondering what it was, and I thought I would just need to be referred to a dermatologist and have it excised. And my internist was like, "No, we should, probably get some X-rays and do some things to check on it and figure out what it really is." I was a little concerned, but he had this look on his face that he was concerned, and I just went ahead and agreed with him to appease him. We ended up getting a CAT scan of my head and neck, and it did actually show some slices of the axilla of the armpit. And when we reviewed it, it showed that I had extremely enlarged lymph nodes. It just lit up like a Christmas tree. They were so enlarged all through my head and neck into my armpit. And to give you a perspective, typically lymph nodes are about 1 to 2 millimeters in size. These lymph nodes were about 1 to 2 centimeters in size, so it was pretty enlarged. There are multiple things, as you know, that can cause enlarged lymph nodes. It could be an inflammatory reaction, allergies. Your immune system is working hard for fighting some sort of infection. I was feeling fine at the time. Again, this was a year after I let go of all the stress. I was just living life, working at the time, and was really about to enjoy the prospect of having a good few years ahead of me in terms of having a family and just enjoying things. So he wanted me to go to an oncologist, and I was like, "What? An oncologist? What?" I mean, medically speaking, that's the right thing to do, but as a patient, that's the last thing that you really want to go talk to or hear. And I begrudgingly went ahead and proceeded because I knew they had the specialties and they had the knowledge of figuring out what's going on, and I said, "Okay, fine." So after a battery of tests, blood work, more scans, bone marrow biopsy. They actually had to go in and remove one of my lymph nodes and to do a biopsy itself. I went back in and, as a follow up. And the first thing he said, when my wife and I at the time were looking at him, and he says, "You have stage 4 non Hodgkin's lymphoma." And that was, I mean, I couldn't even grasp the concept because it was so foreign to me, because that was not what I was expecting, simply because I was feeling great. My normal blood work that you would get, that checks your chemistries and your blood profile was normal. I didn't have any signs of anything. So it was like, what are you talking about? And at that point, it was just sort of like figuring out what I had to do next. He actually offered me to go through this aggressive chemo regimen, and I was like, "Hold on, I'm 40 years old, and you want me to go through this aggressive chemo, and there are no other options." And this was a private practitioner in my area, and where I was living at the time in Jacksonville, Florida, and that's what he felt that was the best thing for me at the time. I immediately, started to take things in my own hands. I mean, I'm a physician, so I'm going to question everything, and I have the knowledge and resources to look everything up and to really educate myself. And lymphoma was not something that I was familiar with. I probably had a few, courses of it in medical school, but that wasn't my area of expertise. So I went ahead and hit the books. I did a lot of research and a lot of online work and just digging and figuring out what the cause of it was. Lymphoma is not something that's genetic, at least my non-Hodgkin's lymphoma doesn't have any genetic bearing at all. And at that point, it dawned on me that it was all about my lifestyle. And it's all lifestyle driven. And I was learning about all the things that could cause lymphoma. It just became really scary for me as I realized that I was doing this to myself. It was a culmination of things about um, eating poorly, not having the right supplementation, not being outside in the sun, not exercising, not sleeping well. And the biggest thing for me was that I was always under a tremendous amount of sleep, never really, amount of stress, and I never really slept well. So all these were confounding factors that just built up over time. Yes, over the year that I was um, uh, not working, and I had that 1 year where I was off work and really enjoying life, even though that was a great to help me, but it didn't matter because the damage had already been done. This was a culmination and accumulation of so many things over a period of time that just got to the point where my body was overwhelmed with inflammation and stress, that it was just a inevitable thing for me to happen. And it was, for me, it was to realize that what I needed to do was to change my life. The private doctor wanted me to start chemo. I ended up going to two specialists, one in Sloan Kettering in New York and one in Mayo Hospital. And both were like, well, you're young, you're not symptomatic, so let's just watch and wait. And that was an option that I have found in my research that can be um, can be a form of treatment. And in my case, I chose that option because I wasn't having any symptoms. And it was during this watch and wait period where I felt I had an opportunity to reverse things naturally and to see if the cancer could regress. And I just employed all sorts of strategies. But in the end, unfortunately, it was a little too late for me. So I ended up having to go to chemo. And after 5 to 6 months of chemotherapy, I was supposed to have 6 months actually, but they curtailed it to 5 because my body couldn't handle the 6th one because my immune system was shot because of all the toxins that were poured into me. It suppressed my immune system. Fortunately, it did the work. I was able to go into remission. And then when I got out of remission, when I was in remission, it was all about, well, at that point to me, it was when I hit the bottom of the barrel because I didn't have the cancer that was on my mind anymore. I didn't have, the whole time that I was chasing the cancer, it was all up to fate in terms of what my life was going to be. I had no control over it. And for a person who's typically a control freak, that was really a daunting, mindset that I had to take in. And it was just, I couldn't deal with that. So when the cancer ended and the remission status began, I was stuck going, what do I do now? And I don't have anything to be mad at anymore. I don't have anything to fight at. And then it was at this time where I discovered, okay, it's time to reinvent myself. I got to dig really deep and figure out strategies in terms of how to live my life because I don't want this to come back again. And that's where the new journey and the new life for me began.
What a story. Now, with that story though, because I know you have the one doc who said, hey, you're going to have to do this very severe, aggressive chemotherapy. And then, you were looking for other options. What ended up making you choose the chemo? Was it just your to the roadblock? What was it? Because I know you were mentioning a little bit of it, but I just wanted to get a little clarification.
Yeah, good question. So for me, it was the watch and wait period was something that we were going to employ. And if there were any things that were going to happen for me in terms of abnormal blood work, abnormal scans, we would begin chemo. And for 6 months, I didn't have any scans. And what happened was I was having this intense back pain. And I was like, it was like flat pain that radiated into my groin area. I was like, okay, I've diagnosed this 1,000 times. It's got to be a kidney stone. And this is weird, because kidney stones never had before. But in states of cancer, you do have an increased amount of calcium because of the cell turnover. And that's what I figured what was going on. Was that I was just turning over a lot of cells because I thought the watch and wait was working because of the new diet and the new lifestyle I was trying to employ. But in fact, that wasn't the case. We got scans, and it turned out that my cancer had gotten really aggressive. The lymph nodes that were 1 to 2 centimeters, they weren't distinguishable individual lymph nodes. It just grew into this big mass all over my body, specifically in my abdomen and in my retroperitoneal area, which is around my kidneys. What had happened was the mass was growing. It was encroaching on my ureter and kidney, causing the pain. So that was a sign where it was like, okay, enough's enough. No more watching and waiting and messing around. Let's hit it with chemo.
Gotcha. And with this process, after you went into remission, with all the research you were doing prior to, what was your next step? What was your mindset after that? How were you looking at things? Because I know you didn't want to go the chemo route. You wanted to have a family. You ended up having to go the chemo route. And did that put you down a course of you said you're a control freak, so I'm thinking you had a vision of what you wanted. This is how it's going to go. Bam! You ended up not getting what you wanted. What happened after that?
Right. When it was told to me that I had to get chemo, that's when I lost all resolve. I literally was so despondent and went into a state of depression, denial, and I was in a lot of anger. I shut people out in my life, and I was just mad, because this was the first time in my life where I had actually had a goal I had set for myself to regress to cancer on its own, and it didn't work. And I felt like a failure. And then at that point, I had zero control over my well-being. It was all up to the medicine. And when I finished the chemo regimen, it was like um, the tipping point for me was when I went to the grocery store after everything had ended and I was in remission status. And then that's when I ran into my personal trainer, whom I used to work out with before all this started. And that was a tipping point for me, because it really, what happened is that we were joking around, and it was the bond and camaraderie that we used to have that really rejuvenated me. And then it got me motivated, because that rejuvenation was just like a spark for me. And I was like, yeah, he asked me if I wanted to work out. And I was like, absolutely, let's start working out again. And as began to work out, I was like, yes, this is the way I need to like live. I need to start like looking at my body and fix my body. I mean, it was an objective perspective, because I could look at myself in the mirror and I knew that I was, slightly overweight. I was slim, but I knew my BMI was high and was probably considered in the obese range. So I was like, okay, this is it. I need to restart the practices of eating well, and eliminating processed foods, and really curtailing things that were contributing to poor diet and poor lifestyle, and really start changing my the way I was putting things in my body, and also had to really exercise. So that was a spark for me that really triggered a lot of changes.
I love that. And then from there, did that start the journey to the book and the whole aspect? Like, because a lot of times in the medical world, I mean, as you know, it's for the gold standard chemo and radiation, and that's it. And from my back hearing, I never really hear like lifestyle changes or even the mindset. How does the mind play a huge role in that, and helping people shift their minds and things along that nature? Was this the starting? Was this the shift that got you into all this, or was it like a stage by stage? Like you did this, then you went to the next stage, you had this phase, and then you went into something else sparked you to go deeper in.
Is interesting, because at that time I was also dabbling in the field of integrative medicine. I didn't know what integrative medicine was, and I just happened to do some research and find that there was an integrative medicine fellowship in a whole field of medicine that really combined the tenets of traditional medicine as we know it with Western with Eastern philosophies and natural ways of healing the body. And that was what interested me, because all the research that I did was really changing the way I viewed things and heal my body naturally using just optimizing supplements and also putting in the right foods. And I learned that food is indeed medicine. And it was at that point that really spawned on the focus on the body. And for me, and I'll get into this a little bit with what I actually did and learned before I start talking about how I discover other strategies unrelated to body. But with the body, for me, it was all about putting in the right foods into my system. I had spent a lot of time in after high school eating junk. And when I was in high school, my parents are vegetarians. And so we ate a plethora of vegetables and healthy foods all the time growing up. But as soon as I went to college, it was all about just eating what was satiating, what was, quick and fast. So I was a big, like, staunch person. I was basically following the standard American diet. And if those are people who don't know, it's really consisting of processed foods, fast food eating, devoid of nutrients, and consuming a lot of sugary beverages. And it was this that I needed to eliminate, and that was the first thing that I was really wanting to do for myself. And it was a hard transition, because I didn't know what was right to put in my body. I understood the concept, but changing from what I was used to eating all the time, fast food restaurants and going to Chick-fil-A or going to Mickey D's or Subway. That was what I was doing all the time. And I didn't know any better, because they don't teach you nutrition in medical school. It was something that I had to learn on my own. And I learned about the process of organic, and how organic is a lot better for us, because if you're eating conventional food, it's full of pesticides, and it's full of toxins that actually can harm our bodies and increase inflammation. And these are things that I had to learn just by reading and researching. And these weren't my traditional medical journals that I was reading. It was just other things that I had come across. It was just something that was shocking when I learned about this, because nutrition was the last thing that we actually, not even last thing, it wasn't even on the list in our curriculum for us to learn. So that was the biggest change for me, and I learned so much about what I was putting into my body and how I needed to change. And what I tell people now is, like, they'll ask me, "So what kinds of stuff do you do to eat?" And I'm like, "Well, I this is what my preference, and what I do is I eat everything. I try to consume on a regular basis organic. I try to eat an array of vegetables, and the array that I go by is the more colors, an assortment of colors that I put into my body, the better it is. And every color of vegetables and fruits that are out there has a different phytonutrient that does a specific part of your body that assists in reducing inflammation in a different way. And so this is how I strategize my life going forward at this point. And this is all stems from my knowledge that I gained from pursuing an integrative medicine fellowship. And I applied and got into the University of Arizona program with Dr. Andy Weil, who was a program director. I learned so much. And it was this that really spawned on my progress of rebuilding myself. And for me, it was the body. And to answer your question, was the body was the first thing that I put my fingers on. And then I moved over to the DC area. I needed to get out of that area where I was in. And what really got me writing the book was that I felt like I had a lot of knowledge that helped me. And I wanted to really put together strategies for people that were in an easy format, and it was a blueprint of what to do to prevent chronic disease and illness. And specifically, my book was geared for people who wanted to change their lives for purposes of preventing cancer. But in actuality, it can really help people for many diseases. It's not necessary to prevent cancer, but it's also something that can be utilized to prevent chronic disease. And then right now we're in a situation where we're fighting this virus, and the virus really can take hold of people who have a weak immune system. And so the strategies in this book and the blueprint that I outline can help prevent the virus from taking a hold of your body, because your immune system is that much stronger.
I love it. And Andrew Weil is an amazing guy, as you know, as you got to experience. And was he the starting point that, like, now, because the reason why I'm trying to get in more into that, the mind side and so forth, is because I've worked with a lot of shamans and so forth and energy healers, and they will always talk about, like, when it comes to cancer, one of the emotions that's involved with it is anger.
Yeah.
And frustration that comes more anger than anything. And was it through Andrew Weil's stuff that where you started to take a peek into the mind and add that into your book and stuff along that nature?
It started that way. And the biggest thing that they emphasized was during the fellowship. Food was obviously a huge part of it, but a lot of it was mindfulness. And mindfulness is defined as moment-to-moment awareness without judgment. And for me, that was a new concept, because I never thought of myself as having an issue with my mind. And in fact, that was a huge culprit for me. Like, I was never a person who really lived in the moment. And when you're living in the moment, there's no stress, there's no emotion, there's no anger, there's no fear. There's just living in the moment. And so we as individuals, specifically me, I was always worried about the future. I was always worried about the past, of what I didn't do. I was just, like, beating myself up for things that had happened to me in the past. And then I was geared as a physician, we were looking at our life from a future perspective, like of high school. It's like, okay, I need to get good grades so I can go to college. In college, I need to do well and take standardized tests so I can get into medical school. In medical school, you're, like, studying your butt off so you can pass these standardized tests to get into a good residency program. And then when you get into a good residency program, you need to take your board so that you can pass them, and then ultimately get into have a good job and practice. And it's always been that mentality for me. So I always looked in the future. And then as a result of looking in the future and looking at the past mistakes that I was making for myself, I was really never in the present moment. And that's what I was starting to learn, was that mindfulness really focuses the moment. And when you're in the moment, there is no stress, there's no worry, and you're able to really combat that constant fight or flight. And for me, that's where it dawned on me, is that I'd been living a life in fight or flight all my life, and I did not know how to live in parasympathetic or rest or digest. And I knew that at the time, and but I didn't know how to like implement strategy or how to use tools to measure the state of fight or flight versus rest or digest. Then, as I was writing the book, I was learning so much things. I Even after the book was written and released, I started to learn more, and I wish the strategies stuff that I've learned after I could have put in the book. But one of the things that I do measure is my RV. And heart rate variability is the measure of the resiliency of your nervous system. And typically it's on a scale from 0 being the lowest, and there's no ceiling. But when you're in the lowest range, you're in fight or flight. And as we know, the more you're in fight or flight, the more it really stimulates your nervous system, and the more it increases inflammation, which can lead to chronic disease. And for me, I was starting to measure my HRV on a regular basis. I wear a tracking tool called the Aura Ring, and it measures a lot of things like HRV, your heart rate, your sleep. It's really the coolest thing that I feel that I've been able to use for myself, for my own personal growth. I started, my HRV was measuring in the 20s and 30s, which is really low, and that was very much an indication that I was constantly in fight or flight. So then I discovered all these hacks and things to help me improve my HRV, and that was through a lot of the mind strategies that I was discussing. Meditation, biggest thing for me was breathing exercises, and there's so much resistance to meditation out there, and it's because it can be considered as woo-woo, and automatically that puts a stereotype on this. But not to mention, people are like, I don't have the time to sit there for 15 minutes, 20 minutes a day to like just calm down. And then when I am in that position, I don't feel like I'm doing it right because my mind's racing. And that's why I don't tend to like focus on meditation. What I tend to focus is on breathing exercises. Breathing exercises is one of the things that you do and implement that has immediate results. I mean, if you sit there and practice a breathing session, it doesn't take very long. You can literally feel your heart rate just calming down. And then you can really also feel that your nervous system is calmed down too. So that's what I learned. And as I was implementing those types of exercises and strategies, I noticed that I was more in the moment, and I didn't really think about the future so much. In the past, my anger was easily subsided. If I felt really angry for whatever reason, I was really able to reduce that anger by really focusing on some breathing exercises. After like a 5-10 minute session of breathing, I'd be like, what was I angry about? And I totally forgot because it was so effective in reducing my stress at the time.
I love that. I'm going to dive into it in a second, because when you get into HRV, that's my wheelhouse. That's what I use I use that in my own private office. So we use it for a lot of things. But it's interesting though too, because when I was going through chiropractic school, it was the same thing. Well, before I got into it, it was all the same process of, all right, I'm going to school, I'm going to graduate. Once I'm done, I'm going to go over here. I'm going to go to chiropractic school. Once I graduate, I'm done. I'm going to start my own business, and then I'm just going to go, and then eventually I'll get to the level I want to be at. And it was just always about what's the next thing. And
Right.
it was a hard process for me too, because I've been meditating since about 13 years now, but in mindfulness and all this stuff. But it was one of those things that even though I was doing it, I was still caught in a trap for a
Mm-hmm.
while, until all of a sudden, it was just like a few years ago, really. I was just like, you know what? I'm just going to just enjoy what is. And I'm going to plan for the future, but if I'm not like holding on to it, it'll be whatever it's going to be. And I'm just going to focus on here right now.
100%.
And I love the Aura Ring. I have one myself. I've been using it for a long time. Well, a little over almost a year now. But it's really great. Isn't it an amazing tool? Like when you're talking about like with cancer or any chronic illnesses, I mean, HRV is a quality life indicator. And that's not my opinion. And it's one of those things that people can use to, you use, I know you said the meditation, but you like doing more of the breathing techniques. It all helps and adds to it in so many fashions. Is there certain breathing techniques or exercises you like, or specific that you choose to share, or you shared in your book?
Yeah. So in my breathing, in the book, I actually share Dr. Andy Weil's breathing technique. It's called 478. And I use that, but I find another technique better. But the thing is that you can use combination of techniques during your breathing exercise. So 478 is what you do is you inhale on a count of 4, and then you hold for a count of 7, and then you exhale for a count of 8. And all this while you're doing this, you really have your tongue that's pressed up against the portion of the roof of your mouth. That's supposed to stimulate some pressure points, and that really lowers your heart rate and just calms you down. That combined with the breathing technique helps really reduce your fight or flight response. And in fact, when I was in lecture, I remember specifically Dr. Weil was actually talking about this technique, and in his practice, he's had several patients that actually who had an irregular rhythm known as atrial fibrillation that would actually, after a few months of practice doing this, like 5 to 10 minutes twice a day, were able to convert back into a normal sinus rhythm, not using any medications. It was just the breathing, because he was in an atrial fibrillation or an irregular heartbeat simply because the person was in a heightened state of fight or flight all the time. And so by implementing these strategies of breathing, it was that really that really caused the conversion back into a normal rhythm. And that was powerful. It's like, wow, you don't need drugs, you don't need anxiolytics, or antidepressants. You can just do this yourself with breathing exercises. It doesn't cost anything, but like a couple of minutes a day. And another exercise that I like to use is called the box breathing or square breathing. It's a little bit like the 478, but in fact is that what you do is you inhale in a count of 4 or 5, or whatever it is that you feel comfortable. Then you hold for 4 or 5, and then you exhale for a count of 4 or 5. And then at the end of the exhale, you kind of hold that exhale for a count of 4 or 5, and then you restart. And the thing is, what's really interesting, you can teach breathing exercises, and by me saying this is great. People can start doing this. But if you're in a state of chronic fight or flight, you're going to be this chest breather. And chest breathing is, for example, the way I describe it to people is if you're running, we want to get air in and out of our bodies quickly. So the way to do that is chest breathe, because we're sort of elevating our sympathetic response and kind of being in a sort of fight or flight. So we want the air to exchange quickly. And if you're if you're experiencing trauma or have chronic trauma, or always in fight or flight, that's the go-to of breathing. That becomes a new normal. So I've always been that. It's only been last year or a year and a half ago where I discovered all the breathing stuff that I was doing was incorrect, because I was chest breathing. I wasn't taking breaths from my diaphragm. And that's where you really get in the relaxation and the parasympathetic to start kicking in. And the way to do that is when you're doing these inhalations, you slightly tuck in your belly and you tuck it in, and that forces the diaphragm to start working, and you kind of continue to hold that belly tucked in through the inhale and through the exhale, and then you'll start to feel the benefits, and you'll immediately start feeling that relaxation coming in.
I love it. Breath work is extremely powerful. There's so many that are out there, and it's all, again, as you said, parasympathetics, and it's just stimulating that, and just teaching the nervous system by changing your pattern, there's a part of the brain system called the the breathing pacemaker. I forget the actual neurological terms for it, but it's one of those things that it's always monitoring how you're breathing, and this is how you can instantly change the rhythms of the body just by slowing down the breath, which then will start to slow down the body. That's why it's so cool when we can take a deep breath in and deep breath out. You're like, oh, I feel a little calmer already.
Right.
That's awesome. How did you then, so you got the spirit side. What is the spirit part of your book, and what does that entail?
So again, my spiritual side didn't really kick in until I started to maybe a few months before I started the journey of writing the book. And for me, looking into it, spirituality does not necessarily have to have a religious connotation. Religion is usually defined as having a group of people that have common set of beliefs or doctrine and practice. Spirituality isn't that. It's really about finding your purpose in life and understanding that we really are all connected together, and we're all connected through the universe, with the universe. And that was something that really kicked in when as I started to research. And for me, at the time of discovering spirituality, I really realized that I was alone, and I through my cancer, I shut everybody out, and that became a new normal for me, is to isolate myself. I didn't know how to converse with people anymore. I didn't know how to connect with people. And I didn't know that until I started understanding and reading and researching about what was going on with me. Like, I had the mind part of it down. I pretty much had the body part of it down, but I knew something was missing. And it was when I was researching, and I was like thinking to myself, why don't I feel right? I still didn't feel like I was, on the path to improving and being in a path of health and wellness. Something was missing for me, and it was that, and it was lack of connection. And loneliness is interesting because it's a risk factor. It's actually a greater risk factor for mortality than smoking a pack of cigarettes per day or drinking a lot of alcohol on a regular basis. And that for me was a eye opener, as I really realized that that was me. I lacked connection. And again, my new normal was living alone, being myself. I worked from home, and I just, didn't feel the need to be connected, but that's what I needed the most, was connection. And it doesn't mean that if you live in New York City or in a major metropolitan hub in the country, you could walk outside and be be around people a lot, but you can still feel lonely because you don't have that connection. And connection is so important in terms of our growth and our spirituality. We are meant to bond with one another. We're not supposed to be alone. And for me, the kickstart that I had was really dabbling into psychedelic medicines. And I write about that in my book. And psychedelic medicines has been a new frontier. It's not really a new frontier, but it's gaining interest again. And there's so much research that's going on. And the FDA has fast-tracked two medicines that will be legalized probably within the next few years because of its improvement on PTSD, depression, anxiety, OCD, and a lot of other mental issues, addiction. And so so it's these medications that I dabbled in, and that really increased my spiritual awareness and really made me realize that there's a bigger purpose in life, and we're meant to be connected to one another. We're meant to bond with each other. And it was also around this point that I realized that loneliness, the cure to loneliness, was obviously to really increase connectivity with people, but the cure to loneliness is to be of service to others. So I started this mission for myself, is to really be more of service and be to others, and help them in any way need in a very unselfish way. And that cures the loneliness feature about us. It allows us to be more connected with people because we're being of service to them. So rather than my life that I used to lead, where it was all about power, money, chasing the dollar, of course, I wanted my patients to have the best. I'm a physician by nature, so I'm a healer by nature, and I always wanted people to get better. But there was also this other confounding thing that society engenders in us, and is to have power and have money. I don't think that way anymore, and I think that's a product of my increased spiritual awareness because of my dabbling in psychedelics.
I love it. Do you mind to share what kind of psychedelics was it? Because I know a plethora of that, but I'm curious to see what was yours and that, so forth.
So what really improved me and what I was exposed to at the very beginning was a combination. The first thing that I was given was MDMA, which is the active ingredient in Molly or ecstasy, is most commonly people are familiar with. And then the other medication that I was also given was psilocybin, or magic mushrooms. And these two medications can work by itself, and these two specifically are what the FDA is fast tracking and have in clinical trials. MDMA is in phase 3 clinical trials, and psilocybin is in phase 2 and soon to be in phase 3. So yeah, these are the medications that I was exposed to at the very beginning.
I heard they're very powerful. I mean, MDA, MDMA is really good for for individuals who are very depressed, or it opens up the childlike in you, from what I've heard. And yeah, that's this. It looks like, so. What is it? Stage 4, and then that's it, or is there a 5? I can't remember.
There is a 4, but once you get through 3, then it's pretty much home free at that point.
Gotcha. Yeah, because I know those two. I know ayahuasca is another one. That's what I've had experience with. And it's another thing just to help, again, like you're saying, connection and seeing the bigger picture outside this realm and how we're all interconnected and so much more.
And it's really important that, these medications are out there. I've done ayahuasca, but the most important thing, and I write this in my book, is that if you're going to choose to do these medicines, you really need to be sure the person who's administering it, that they've had a lot of experience, that they feel safe to you, and that they provide a safe environment for you to experience this. Two of the biggest things that contribute to a good experience is called set and setting, and you'll read this in books about psychedelics. Michael Pollan's book that came out about a year and a half, 2 years ago, talks about this. It's called How to Change Your Mind, and it dabbles in all new psychedelics. But the two most important things is to have proper mindset going into the experience. If you're having anxiety, if you're having issues with fear going into the experience, that's going to influence your actual psychedelic experience, and it may not be pleasant. And then setting is important too. So if you're not in a safe setting, if you do not feel safe, or if the person that you're with who's providing the medicine, if you don't feel comfortable, that's going to influence your journey too. And I found out that the hard way. My first, I had some good experiences with a facilitator, and then I ended up feeling that, everyone's going to be the same, who's in this work. And it's not true. One of my worst experiences that I've ever had was because I was in a setting that I didn't feel safe in. I didn't know people. I didn't really feel comfortable with the facilitator. And I was going in there with an increased anxiety anyway. So I had a horrible, horrible experience. And it can also traumatize you if you don't take into consideration those two variables.
I couldn't agree with you more. And also, too, sometimes ayahuasca also brings up your fears in a sense. At least from my experience, and the first time was very bliss and all this amazing things I needed to get, and then all of a sudden, ego needed to get its butt kicked. So it was interesting. But I digress. Awesome stuff. One question I have wanted to ask is, who are you today versus who you were in the time leading up to your diagnosis?
Oh, I'm a totally different person. I'm a lot more calmer. I am more in tune with who I am as an individual. I'm more in tune with my body. I know what my body needs. I listen to my body. And I am more aware of toxic things that my body can be exposed to. And I really want to be in a position where I have control over what I put into my body, and more importantly, I have the ability to eliminate those toxicities and toxins and put a value on my health. And then also for me, it's like I am a different person because I have connection. I do have a group of people that I found in the DC area, sort of, it's called my tribe, I call them. Everyone should have a tribe. And it's like, I know they have back if anything happens to me. I can go to somebody if I have an issue and not feel shame or condescension. It's really important that people feel like they have a connection with people. And the big thing is that, we really, in the spirituality sense that I learned, is that our our mindset, our frame influences our health. So if we have a negative mindset about things, we're going to attract negativity. And that's just the law of the universe. That's just what's going to happen. And it's really important to have a positive mindset. What I practice right now is that I have a positive mindset, and I also practice gratitude. Gratitude has also shown, to reduce your state of fight or flight, reduce inflammatory markers in your system. And I try to practice these things where I'm always positive. I wake up in the morning and, I say to myself what I'm grateful for, and I spend a few things just to in my mind. And before I go to bed, I also try to think about the day that I just went through, and I point out the things that I'm grateful for. And again, I try to go to bed with a positive mindset. So it's really a combination of things that's led to where I am and who I am now, and that's optimizing my mind, body, and spirit.
I love that. I love the journey that where you were to who you are now, and that it's just like you're a whole different person. And I feel from what I'm hearing, and I'm going to ask you the question anyhow, you feel like you're more in control in your life now when it comes to your health and so much than before.
I do, but the thing is that I and this is one of the things I have to work. I have a very strong ego, and we really need to surrender to and just let things happen. And the more we surrender and accept it, the more things are going to come to us in abundance. The more we're going to appreciate things, and the more we appreciate what we have, and we live in a society where there is abundance. It's just changing that perspective. So that's what I have to work on, is really reducing my ego and reducing the control that I need to have on things, because that's just been 40 plus years of living that way. It's something that you can like change and transition to overnight. But for me, it's the two things I work on now: is really living in the moment, trying to be more mindful, and then also trying to surrender to the universe and just not feel like I need to have so much control over everything.
I'll tell you that's a hard thing. I think many of us work on and get to, and it's like the masters who you see these guys, or women too, who are like in their 60s and 70s and 80s, and they just have this childlike look to them, and they don't worry about anything. An asteroid could be coming to the Earth, and they just sit there and be like, well, and then it's just like nothing.
Exactly.
So it's a process. I love it. Real quick, how can people get a hold of you, follow you, connect with you? And to see what you're up to, get access to the book and all those things.
Yeah, so you can access my book through Amazon. The book, again, is called From Doctor to Patient, Healing Cancer Through Mind, Body, and Spirit. My website is under construction, but it's still there, called FromDoctorToPatient.com. And then I also have a podcast series that I also launched back in January. And each week we feature a guest, and we discuss different healing modalities that are off the beaten path but are backed by science and facts, and that's also called Doctor to Patient. So those are the best ways to find me.
Awesome. Dr. Diva, it was a pleasure having you on. I had a lot of fun getting to know more about you and your story and your journey, and the transition from the medical to more, I guess you want to call it holistic or spiritual and all that. I love it. Vitalistic, another term, but however you want to label it. But it's really fascinating to see that shift, and now leading a life the way you're leading it and now helping others. Appreciate that.
Thank you. Thank you for giving me an opportunity to talk about it.
Thank you for listening to the podcast. For past shows, please visit www.empoweryourreality.com. I hope this show inspired you and added to your life to help you on the journey to rediscover who you really are. To connect with us on Facebook, please visit www.facebook.com/Dr. Vic Manzo. Check us out on Twitter. The handle is Dr. Vic21. Follow us on Instagram, www.instagram.com/Dr. Vic Manzo. If you were inspired by the podcast, pay it forward by sharing it with someone who you know can benefit from it. Thank you again for listening to the Mindful Experiment podcast, sharing paths to help you rediscover your infinite potential.